Like I earlier said in my previous video, cryptic pregnancy is not the same as the fake pregnancy scam we keep hearing about. Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for all my viewers. Today I'm going to be talking about cryptic pregnancy. What is cryptic pregnancy? How common is this cryptic pregnancy? Who are at risk of coming down with cryptic pregnancy? Is cryptic pregnancy a blessing or a curse? And also, what are the complications that are likely going to arrive from one having cryptic pregnancy? Today, I'm going to be sharing with you everything you need to know about this so-called cryptic pregnancy. But before we go into details into this class, if you are new on our YouTube channel, if this is your first time on our YouTube channel and this is a content or these are content you are interested in and you would love to know more, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Let's go. Alright, welcome back. Like I earlier said, today I'm going to be talking about cryptic pregnancy. What is this cryptic pregnancy that we keep hearing about? Before I go further into today's class, for those that have not watched our video on the fake pregnancy scam alert that is trending, that a lot of so-called professionals, I believe they are not doctors, are using to scam women and they give them babies that are not theirs, I'm going to be leaving the link in the description box below so you have access to this video, watch and get enlightened, because cryptic pregnancy is actually different from that fake pregnancy alert that you see trending. Back to the video proper. What is cryptic pregnancy? Cryptic pregnancy is also known as stealth pregnancy. And cryptic pregnancy is a type of pregnancy in which an individual is pregnant, but she's not aware that she is pregnant. An individual is pregnant, but that individual, that lady, is not aware that she is pregnant. Let me use myself as an example to explain cryptic pregnancy proper. Looking at me, I am Miss Mary. I am 4 months pregnant. I don't even know that I'm 4 months pregnant. Yeah, I don't even show signs and symptoms of pregnancy. I am 8 weeks pregnant, there's no sign. I am 12 weeks pregnant, there's no sign. I'm 20 weeks pregnant, there is no sign. Then finally, when they discover that, oh, she's pregnant after 20 weeks, 22 weeks, they're like, oh, Miss Mary had cryptic pregnancy. So it's simply that pregnancy an individual is not aware of. Most times they are not aware of this because they don't show signs and symptoms of pregnancy. They don't show anything that will trigger them to say, oh, let me go and do this pregnancy test to know if I'm pregnant. Then also, most ladies know that they have cryptic pregnancy when they have this, when they start realizing the signs and symptoms of pregnancy, and also when they miss their period. When these two things happen, they tend to do the pregnancy test and they confirm that it is pregnant. They are pregnant. So that is what, in a layman's term, cryptic pregnancy is all about. Then that takes us to the other topic. Who is at risk of going down with this cryptic pregnancy? The first one I have here is recently put to bed. Women that are recently put to bed, they are at higher risk of going down with this cryptic pregnancy. Let me explain why. When you put to bed, it is very, very difficult to know your first ovulation. Yes, it is very, very difficult to know, oh, my ovulation came because you were not seeing your menses. Because we are breastfeeding, your menses is not coming, ovulation is not taking place. So to actually know your first ovulation will be very difficult because you've not calculated what your cycle. So those that recently gave birth, they are at risk of going down with cryptic pregnancy. That is why you hear ladies say, oh, I have been breastfeeding, but all of a sudden I am pregnant. I don't really know why. I didn't even see my menses, but I'm pregnant. It is possible that the first ovulation after during the process after birth, the first ovulation after birth, that was what led to the pregnancy. So if you just put to bed and you don't want to get pregnant immediately, you just have to be extremely careful. If possible, do a family planning to avoid cryptic pregnancy. Then the second people who are at risk of going down with cryptic pregnancy are those that have conditions like polycystic ovary syndrome. You know, polycystic ovary syndrome, these people, this set of people, they have long duration of the long duration intervals between their menses. Most times when their menses don't come out on time, they're like, oh, it's a normal thing. I don't usually have a regular cycle. I don't usually have my menses like every month like other ladies normally do. So they don't really have the mindset that they could be pregnant. So people with PCOS, because they usually have this skipped period, they are at risk of going down with cryptic pregnancy without them knowing that they are pregnant. Then the third set of people that are at risk of going down with cryptic pregnancy are those on birth control pills. For those that are doing a family planning method, they are taking some pills to prevent pregnancy. When sometimes this family planning method, they are not 100% effective. Some people might be on family planning method and end up getting pregnant. So people on birth control pills or on family planning method, they are at risk of going down with cryptic pregnancy without them knowing they are pregnant. So you just have to, as an individual, to be careful. Then another one I have here is those at their perimenopause stage. Those that are like, oh, I'm already old. There's no way I can get pregnant. I've passed, I'm close to my menopause. I am old. Sorry, it might shock you and you're going to develop cryptic pregnancy and you're like, oh my God, I thought I was already old. I thought I was already clocking my menopause. Because during this perimenopause level stage, your menses might not be coming back to back. You might not have a regular cycle like you used to see. So you're already used to, oh, my cycle is no longer regular. My menses is no longer regular. So a baby might just be inside and you as an individual will not know that a baby is inside, or you start suspecting, oh, maybe it's just my normal skipped ovulation, skipped menses that I usually experience. So those that are close to menopause are also at risk of going down with cryptic pregnancy. That's why you see women of 50, like of 30-something, 40, that are already like, oh, I didn't expect I was going to be pregnant. This is God's gift at last. That's what happened. Then also the other people that are at risk are those that have not gotten pregnant before. If you've not gotten pregnant before, you are at risk of cryptic pregnancy because you don't even know the signs and symptoms of pregnancy. You don't know your cycle. Also, you might be at risk of going down with cryptic pregnancy. So that is that. I think that I have to share with you in regards to those at risk of going down with cryptic pregnancy. So there are some questions that popped up in regards to cryptic pregnancy that I want to answer. I actually documented them here because I don't want to leave anybody's question untouched. The first one was, will it show on pregnancy test? YES. Yes. When you have cryptic pregnancy, you do a pregnancy test. It is going to show on the pregnancy test strip that you are pregnant, except you don't know how to use it or you use the home pregnancy test kit wrongly. Then the other one was like, do you get your period? Yes. When you have a cryptic pregnancy, you see your period normally. Same way you don't see your period. Sorry. I'm not cutting this video. I'm just going to apologize and continue. Do you get your period with cryptic pregnancy? The answer is no. You don't get your period during cryptic pregnancy. But you might experience implantation bleeding. Normal implantation bleeding, when the baby is trying to implant around the uterus, around the womb. That bleeding, I think I've made a video on implantation bleeding. You can go back and watch it. So if you have cryptic pregnancy, you will not see your period. Before I say yes again, you will not see your period. Then another question is, what causes cryptic pregnancy? Like, we talk about the risk. So the first thing that is likely going to cause cryptic pregnancy is people doing the home pregnancy test. They don't know how to do it correctly. So despite having signs and symptoms of pregnancy, they'll go and get a pregnancy test strip to do their pregnancy test. But because they don't know how to do it correctly, the pregnancy test strip might show negative. And they're like, oh, I am free. I am not pregnant. Not knowing that there's a baby growing in there. And the other one is no pregnancy systems. The other one is does not have pregnancy symptoms. Yeah. When an individual does not show the signs and symptoms of pregnancy, they might. That's why people will like, the first 3 months of my pregnancy, oh, I saw shake, I was having nausea, I was having vomiting. Some people will not just show those signs. So that will not even persuade them to even do pregnancy test, because they are not showing the signs and symptoms of pregnancy. So that's the question. Then the other one asks, like, how do you diagnose you have cryptic pregnancy? Normal way of testing pregnancy, normal way of knowing you are pregnant, through urine sample, doing the test through urine, doing the test through blood, and also ultrasound. So don't let anybody deceive you. If it's cryptic pregnancy, it's going to show when you do an ultrasound scan. So don't let anybody tell you that cryptic pregnancy does not show in scan. I've told you, cryptic pregnancy appear clearly on the scan. So it's like normal pregnancy. Then the complications that are likely going to arise from cryptic pregnancy, the first one I have here is no pregnancy care. Like, because you don't know you are pregnant, you will not go and register for antenatal. You will not get the necessary vitamins that you were supposed to give you during the course of your pregnancy. And that can predispose the baby to some congenital malformation, to some congenital formations, because you were not giving the baby was not taking folic acid, was not taking those necessary vitamins, those necessary pregnancy vitamins that this baby needs to actually develop. So that might result in some congenital abnormalities. Then also, if you don't know that cryptic pregnancy might result in some medical conditions such as your gestational diabetes and all that. Then also, those that are smoking, before, you know, when you are smoking, you are drinking, when you know you are pregnant, you stop, you limit, you stop, you try as much as possible to stop, because it's not good for the baby. So if you don't know you are pregnant, you won't make that adjustment. You won't stop smoking, you won't stop drinking, you will just continue, and that is not good for the baby, and that is not good for the fetus. So these are the complications that are likely going to pop up from cryptic pregnancy. Cryptic pregnancy is still the same as your normal pregnancy, just that this individual that has cryptic pregnancy does not know on time that she is having cryptic pregnancy. You get? So that's just the difference between cryptic pregnancy and normal pregnancy. Every other thing remains the same. Exactly. So for those that say cryptic pregnancy does not show on scan, I don't know about that. So I've come to clear the air so you have an idea of what cryptic pregnancy is all about. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mary saying thank you. We are moving forward to 500k subscriber. Bye, and see you in our next video. Bye.